And right now on Showbiz India, I have a very special guest and a very special segment, Dr. Malini Ranat. Welcome to Showbiz India. And first of all, it's great to see you. Secondly, let me just do a small introduction to the viewers. You are a medical doctor. You were trained at UCLA. And I have to say, you're gorgeous inside and out, of course. You are right now being inpatient at a hospital during this crisis. What made you risk your life at a time like this?
Well, hi, Reshma. How are you? Always nice to see you. Honestly, that question, what made me want to do this is I have a duty. I mean, I took an oath in medical school, but more exceedingly, it's my passion. Medicine is my passion, and I want to make a difference. And I feel that they need us. And I think this is the time that, we all need to come together. And if there's anything that I can lend, training wise, procedure wise, or just seeing my patients, I want to be there.
Well, that's amazing. Much, much respect to you. We need more people like you in this world. Tell me I'll take you back a little bit. What made you decide to choose medicine?
Oh, that's a very long and, there's a lot of things actually. It's not any one thing, but I would say that when I was 11, I suffered a very tragic car accident. The car accident, to just, limit the details, was pretty tragic in the sense that, they didn't know if I was going to live or die. And I think coming out of there, suffering multiple injuries, brain wise, bone wise, not being able to walk, I just got a second chance at life, and I will never forget the healthcare workers and my physicians, and that motivated me to strive for medicine and that anything is possible. And I want to someday, if I haven't already, make that difference in someone else's life.
And you are. Wow, what a story. Well, we're so happy you survived it. And what a noble way to choose a profession. What are you seeing in the hospitals right now?
So, Rishma, it's like such a combination of things. Of course, there's a widespread fear. So, any kind of symptoms or even natural allergies, like I'll have allergies or, a runny nose, or people instantly think, oh no, I have COVID. So, they do run to the ERs in the hospital, and we see a lot of that. But we also, on the flip side, see a lot of critically ill patients that are unable to breathe, both healthy and non-healthy with risk factors. So right now it's just trending up. The ERs and the hospitals are getting more and more busy.
And you were able to take a COVID-19 test yourself, you said to me, and you were
Yes.
negative. That's amazing. But how is that? Are there enough tests available for people?
So the rapid tests are now trickling in, but to be honest, Reshma, even the PPE, the proper protective equipment, we were limited on. We have to reuse them, and we're working on, our hospital is actually doing a good job of trying to get those resources. So let alone the testing, yes, we have a PCR, but it's taking quite a few days to even get back, which is, a way to test for COVID in patients we've admitted. But the rapid tests are still, I mean, there are drive-throughs in the neighborhood, but we are lacking a lot of resources. But, people are coming together, and slowly we're able to get more and more resources, rapid test kits, and becoming more available.
Now, you're also a mother. So how are you doing with your family? How are you keeping up emotionally? What are you doing to protect yourself physically?
So that has been actually a big struggle of mine. While there is one side of me that's a duty to treat and do no harm, on another side, medicine was my life and my passion. But I quickly realized the minute that girl was born that I have another passion. Who knew that motherhood would be something that have the same respect for, just like my passion for medicine. So it's been hard. What I have been doing in the hospital, I'll shower before I leave. When I was initially in the initial stages of this, I will change there. I come home, I strip down in the garage, I take a shower, I sanitize, and I would keep a distance between me and my daughter. But as the numbers are climbing, and of course our peak is approaching, or what is predicted, soon actually our hospital is offering housing for healthcare professionals that are actually participating in this healthcare crisis inpatient. So probably in about a week or so, I probably will not be coming home and staying in a designated area just to keep, my family and my daughter and people in general protected.
Oh, that's such a sacrifice. Really, so much respect for you, Dr. Nath. And we continue to pray for all of you and everyone who's affected. And please stay safe. That's the most important thing. Tell us, what would you like to share with the viewers today about staying safe and staying at home? What's your message to them?
So we all see it everywhere. You see it on CNN, we see it broadcasted everywhere. Please, you guys, we as healthcare providers, all of us, doctors, the janitors, the nurses, the respiratory therapists, the pharmacists, we are all going to work, and not everyone has to be there in the hospital, but we're choosing to be there. So please do your part and stay home, because this thing, the more people raise awareness of staying home and not less out in the public, the better we are going to be able to tackle what's to come and contain this virus. And, stay home. Stay home, even if you're young and you're healthy and you don't think you're going to get sick, but you could be a carrier and you could pass it on to your older father, your uncle, your grandfather, and they may suffer something life-threatening that we may not yet have treatment for, and you just never know. I would stay home, and that is like my biggest advice.
And also on a lighter note, Dr. Nath, you're also an aesthetic doctor. So of course we're at home, but little tips on how we can look better even staying at homes, because it makes us feel better. Can people contact you for any questions or anything they would like to talk to you about?
Of course, anything medicine related, any questions about COVID, any questions about skincare, motherhood, you name it, send out a question and I will do my best.
So where can people get in touch with you?
So on Instagram, it would be Dr. Ranat MD. So it would be doctor as in Dr. Ranat MD.
That sounds great. And so people can DM you and follow you, and we look forward to seeing you. And again, stay safe.
Thank you, and you too. And God bless everybody, and hopefully everyone is safe, and I don't want to see anyone in the hospital.
That's right. Stay home, everyone.